I think about engaging a patient, well, if I'm engaging, there's an I, and then there's a someone else, right? There's an object, and then there's the subject. So you've got two people, and there's communication that's going on back and forth, right? And even acknowledging that the patient has a huge amount of accountability in terms of their own health versus I'm a patient, I come in here, provider, treat me, make me better. So I think acknowledging that as a foundational part of patient engagement, that it's two-way, there's, whether it's a provider, or it could even be an insurer or a biller, it could be any number of people, but you're engaging that patient probably because you want them to change some kind of behavior. So here we are back to this change management piece. When you think about chronic illness and what causes it, it's about behaviors. It's just about changing behaviors. And getting somebody to change their mind about something is not a particularly easy thing, right? I mean, we're in the height of political season right now, so I think we can all think of some example in our minds, right? That's a little bit relevant there. And so these are deep-seated beliefs, and you've got to know who you're talking to, and you've got to know how they see things. And there really is kind of this give and take and back and forth. So I propose that there are a few things that need to happen to make that a little bit easier. I've got to trust you. I've got to believe that we're...
As a patient, you have to trust.
Both ways, both ways.
Okay,
How many, my stepdad is a physician, so I'll go ahead and I'll throw this out there. He's a cardiologist too, so he's the kind everybody lies to, right? No, I don't eat that. No, I don't smoke that. You know, absolutely not. And so, right, if you don't even know what the reality is of my behaviors, we're not having an honest dialogue there. So there's some truth, right? So I think about that as being an important part. I think about trust, and I think about transparency. So those are kind of three things that I think about related to being able to influence someone else's behavior. I'll pause there and I'll let you go, because I think we could do a lot of things with that, and I could keep going, but I'll pause.
Yeah, and I'll actually, a lot of what you said, same concept, same ideologies that I have in terms of what does it mean to engage a patient? And for me, it's about really empowering that person, giving them a voice for them to be active, to be an active participant in their care, okay? I think that when, just 10 years ago, when you went to the doctor, you waited to hear your results, and you really didn't know where, it was almost as if your medical records were like a secret. Whereas today, you have full and complete access.
In theory, you're supposed to have.
Well, correct.
That's a big hurdle too.
And I'm sure we'll talk more about that. But
even agreement that that's the goal, I think is a step, right?
And let's just say hypothetically, if that is the best case scenario, that you do have access to your medical records.
And HIPAA says so, but a lot of providers put up hurdles either because they don't know or they don't want to take the trouble to make it easier to do so. And I know, Kelsey, you worked at Epic, which was one of the first companies to really get into, to make the portal work for lots of people.
Yeah.
So.
There are lots of nuances there too. But ultimately, the patient, having access, having control of the data, I think is an important piece of this. So
and
but if the patient wants to, right?
Right.
Because I'm not I'm a technology person, blah blah blah. But I don't feel like logging in to my gynae's portal, then my primary physician's portal. I'm a breast cancer survivor, then to my cancer, it's like, just send me a frickin' email or leave me a message. The results came in today, call my office tomorrow. I don't want yet another password to remember. I don't want it.
And
I don't want it.
And Gladys, I can appreciate you saying that your preference is, please just pick up a phone and call me. So again, when we're talking about patient engagement, for me, it's also about choice.
Right.
Right.
You can say to your provider, the healthcare professionals, that my preference is for you to give me a call and I give you the authority to leave a message. Some people don't want that. Some people do wanna log into a portal, take a look at every test, know all of the exact, details.
Some people wanna manage it themselves with
Right.
a third-party app.
So,
It's
I think
not
that's,
many, but
we've come
they're out
very
there.
far in where we are with respect to being accountable and having ownership of our own care. I mean, certainly we have a long way to go, but I think we've taken some great steps, and I think there are some fantastic and wonderful tools that allow us to be more engaged with our healthcare. Because I think the purpose is to promote better outcomes, try to improve quality of care. I mean, certainly from a government standpoint, public health standpoint, we want to look at ways in which we can implement innovative programs, still reduce costs for, with healthcare, and just get people more engaged so that it's closer to prevention or managing some type of chronic condition that a person